Welcome back to the show Talk with Your Doc. With me is Dr. Gabriel Mapeso, who is a surgeon at Thunder Bay Regional Health Science Center, and we are talking about ulcerative colitis and Crohn's disease. Dr. Mapeso, we were talking about various investigations and various treatment options, which included the medical line of treatment, the dietary changes, the lifestyle changes. One of the factors which you were mentioning about the food, and you were mentioning about pesticide use. Can you please tell us about it?
Yes, apparently almost every food that that's when I mentioned the processed food, because there are antibiotics, there are pesticides, and it has been sort of indirectly blamed, and it's very difficult to put a direct evidence to it. It's controversial, but there is some strength in the argument that we are doing harm to ourselves by using a lot of these pesticides, antibiotics, and modifying our food. And so, hence the rise of some of these diseases.
So organic food is better than the pesticide?
Definitely organic food is better than that one. And in fact, if I remember right, when I just came back from the Philippines, and I was, they were cooking a chicken soup back home in my house, and I was surprised because sort of I haven't gotten used to it, because there was literally no fat. Like the soup had no fat at all. You had the skin, but no fat. But in here, it's very fatty.
Right.
And because of the whatever they do, growth hormones and whatever they add to make the meat.
So if patient is not being controlled with the medicine or lifestyle or dietary changes, or if the disease remains for a very, very long time and it is affecting the life of the patient, is the surgery a choice?
The surgery is definitely a choice once you have arrived at the conclusion, usually for a few reasons. One of the reasons is failed medical treatment. If the medical treatment doesn't control the disease, dietary changes or lifestyle changes, whatever, and you have also gone to the third line of treatment, then surgery then has to be considered. Surgery is not taken lightly, because it can be life-changing as well. You might end up with a stoma. You will have a major bowel resection. If there are fistulas, depends on the segment of the bowel involved. It may be there may not be so much change in your bowel habits. Depends on the extent of surgery.
So a young patient who has to resect a segment of the bowel, or the intestine has to be removed, what happens to him for his lifestyle then?
Well, in general, if you resect less than a third of the small bowel is more important for life than the large bowel. You can live without your large bowel. That's not to say it's not important, but it is important for us to function well. But the small bowel we need the small bowel. So if you resect less than a third, usually you can absorb the nutrients. But if you resect like a third, a half, then it starts to affect your nutrition. If you resect and leave a third and you resect 2/3, you have a problem with malnutrition.
Okay. So if more amount of small bowel is removed, it is more worrisome for the health?
Yes, correct.
So for those patients whose segment of small or large bowel has been removed, do they have to carry the bag always, or what happens to them?
There are ways to sort of recreate continence, especially if you lose your rectum or the large bowel and the rectum, and they try to make a pouch, we call it. So a lot of people refer to the pouch. Can I have a pouch? So a pouch is a way to make a reservoir so that your bowel will stay, or you will stay continent, and has a reservoir for the stools before it comes out. Now that can be a bag, a reservoir in the skin here as a bag, which you don't have to empty as often, but more preferably for younger people, they would prefer to have the normal continence. And so it's a pouch between the anus, and they recreate the small bowel that is not affected into a kind of a bag. Okay. So they call it a pouch.
Right. Now, so after the surgery, how is the lifestyle? Is it like normal, or are the patients feeling better, or what happens to them?
It all depends on what they have. So if they have the pouch, then they will be almost as normal, although they may be going to the washroom frequently, but they don't have the disease. It's a question of the capacity of the pouch. Now, if they have a stoma bag, it all depends. The one aspect that we haven't actually talked a lot is that a lot of these people, because of the chronicity of the problem, they do have it has a psychological burden or stress on anybody because it is very debilitating. And so it all depends on your outlook. And some people have a very good outlook with their bag, and some people don't have it, they don't like it. So it all depends on your outlook of the treatment of the disease. And also you will now have a new lifestyle. If you have a bag, you have to learn how to take care of it. It is now your bag, and it is now your pouch.
So it remains there for
different.
Lifelong. The bag is there for lifelong.
It is lifelong.
The patient who are treated with the surgery, are they increased risk for getting cancer of the colon?
It's very good you mentioned that one, because I think of all the things that you have mentioned, the most important for my surgical, my specialty as well, is that inflammatory bowel disease carries a risk of cancer. So if you, especially ulcerative colitis, if you have more than 10 years disease, 1% every year is the chance of you getting a cancer. So and that's the reason why we follow you up with colonoscopy and biopsies to make sure that there's no changes in the lining that are going or heading into cancer.
So how often one should get colonoscopy done then?
The colonoscopy is usually done every few years, every 4 or 5 years, depending on the severity of the disease. Sometimes you follow it up every year. If you have the disease for more than 10 years, generally it's more frequent than every 5 years. So sometimes they do it even yearly for some people. And the biopsies are a lot. It is a lot of biopsies, because the recommended biopsies are several biopsies every few inches. So they take samples of the lining of the bowel, because it's very hard to detect the cancer grossly at the microscopic level. They have to detect it. So it is very, very important to talk to your doctor about the biopsy results to see if there are any risk or changes suggestive of cancer or heading towards it.
Are there any new treatments or alternative treatments available for the inflammatory bowel disease?
Yes, the newer treatment right now are the biologics. They are treating it. It's a very, very high, a very specific treatment for the immune system. And then there is some anecdotal treatments like changing your gut flora, fecal transplantation. Anecdotally, there are some people who get better with it, but it's the icky factor that people don't like it. But what it boils down to is that there is a good evidence that if you change your bacterial flora, meaning your diet has to change, the type of food that you eat, the type of chemicals, whatever that'll be that we're eating is harming us, it has to change.
I was reading an article which was mentioning that our so-called healthy lifestyle, when the children are very small, and we prevent them from so many infections by giving them hygienic food and hygienic items. But those natural infections which children get during their childhood, that might boost their immunity to protect them against the ulcerative colitis and Crohn's disease probably.
Very good point. Our body, as we develop, needs what we call an immune challenge. So if our immunity is not challenged, then we don't develop the same way as we are vaccinated. So every infection we get, like a flu, we get immune to it because our body develops resistance. So if you are isolated totally, you will not be immune to almost anything.
So too much hygiene is not good.
Too much hygiene is not good. And I don't know now, I have to look back at it, because as a kid I was rolling on the ground, playing on the ground, and crawling and doing whatever with the other kids. Were playing in the mud. Now, having said that, it's not a dirty canal, whatever, but we were playing in the ground and everything, and now we try to avoid kids from doing that. I think we're not developing their immune system very well.
Yeah. With that note, thank you, Dr. Mapeso, for coming and participating today in the talk with your doc.
Well, thank you very much.
It was very helpful to know about the disease. Thank you so much.
More than glad to be
Thank you everyone for participating.